Association and the Royal College of GPs have all argued for more time to get the public on board. The new system has been pushed back to the 1st of September. That's 2 months to create some trust and transparency around a project the government says will save lives. Well, let's take that a little bit further, because joining us now, Tina Woods, the Chief Executive of Collida Health, who works with NHSX, which looks at the use of data and technology in the NHS, and Phil Booth from Med Confidential, which campaigns for privacy in healthcare data. Tina, can I just start with you and get you to explain for us why this is such a good thing? Why should we be embracing it?
Yes, absolutely. I hope you can hear me. Yes, I think embracing this, the use of data is a good thing. We talk a lot about the downsides, but there's so much upside. And I'm saying this from the perspective of working with many entrepreneurs, tech innovators, pioneers, and obviously medical researchers. And of course, our perspective is that, there's so much to gain from sharing data. I mean, most people don't realize that data is the most valuable asset in the world. It only grows in value the more you connect it. And of course, health is a massive area. We know big tech is investing heavily in this area. We know smartwatches and Fitbits, they collect data to help us manage our health. But there's a massive public prize in the public sector to be able to do the same to protect our health. I mean, coming out of the pandemic, we know that we suffered most in Europe, from the effects of COVID, and that was really down to our ill health and made worse by our inequalities. So I got a text message from my GP 3 days ago to measure my blood pressure. So that proactive conversation with my GP is a good example of what you can do with data sharing.
Okay. Let me bring in Phil, because I think we do recognise how valuable data is. Phil, are you happy for that data to be shared?
So we're very happy with legitimate, ethical research uses and many of the things which Tina has mentioned. But it's the stuff that's not being talked about here. Tina mentioned that this data is incredibly valuable to big tech and others. And it is the very involvement of commercial interests and the somewhat hidden trade in patient data, which is going on at the moment with our hospital data and stands to continue with our GP data, that is causing most people most concern.
So in terms of the kind of experience we've had with sort of data collection before, Tina, I mean, you look at things like, I think it's called HES, Hospital Episode Statistic, or the care.data, that there is a kind of underlying issue when these things are introduced, and quite often billions of pounds are spent, and quite often they then have to go through a review. I think this one was subject to a Partridge review. And it ends up with people not really having trust in the government using our data in the right way.
Yeah, absolutely. And that's well understood. And of course, the care.data fiasco is there's been a long memory with that, and that has not left us. And it's a shame that not more was learned from that incident to essentially prevent what has happened again in this situation. So yeah, I mean, I think there has been a loss of public trust over that, and certainly again. And I think really what this shows is that there hasn't been enough of a public debate about all this. I mean, and what tends to happen is that we hear these sort of, these scare stories about what happens when, you lose control of your data. But rather, we need a much better informed discussion, which is happening, in the academic circles, in the research community. That needs to go and reach the public so they can understand the upside. I mean, we share our data all the time. We get a benefit from sharing our data. So we need to have that same dialogue and make it really clear what we're getting as a benefit for sharing our data, which is humongous and colossal, but we need to have that conversation.
Phil, do you really think the public aren't on board, given how much data we share all the time?
Many of the public are not on board with this particular GP data grab, for the precise reason that Tina said. They haven't been involved in the conversation about it. They were not informed. This was announced on the 12th of May with a 6-week deadline until their data was going to be uploaded. And we are talking about an upload of every single person's entire GP history, each item associated with their NHS number, their full postcode, their date of birth, okay? Temporarily obscured with something called a pseudonym, but this is personal data being gathered for uses which still are not being fully revealed, even by or in what are called the data release registers, which NHS Digital was forced to publish after the care data and HES scandals of 2014. So lessons have not been learned. And the really important thing here is not about scare stories or just selling the benefits. That's a rather sort of polarized sort of debate. The fundamental thing is that patients must be able to trust that what they say to their doctor will be kept in confidence. People need to share things which are, quite intimate.
But it will never have your name on it or my name on it. I mean, that's what a pseudonym is. It will never be traced back to me or you, will it?
Your NHS number, which is, if you like, a sort of pseudonym, provides all of that information. A system called the Personal Demographics Service, which NHS Digital controls, holds all of your information, your name, your address, your contact details, all of that. Basically, the key to that is your NHS number. The NHS number is an identifier, how you are represented in the NHS for everything.
Tina, one of the oddities of this is that it's such a difficult system to opt out of, and that there hasn't actually been very much debate. We've heard very little about this from the government themselves until this morning. I mean, either they want transparency and it's a great thing and they get it out there, or else they're sort of running it under the carpet quite quickly when nobody seems to even notice. Which is it? Tina, we've just lost your sound. OK, well, I want to leave Tina with that point when she can, but get back to us.
But Phil, you raise a very good point.
Well, but let me raise a different point to you, which is that we have to be having the mature debate, because otherwise we will always be scared of the future and its advantages and the technological advantages that it brings, because we are constantly bringing the shutters down on this.
Well, I don't think that's necessarily the case. I think we framed this as three simple, straightforward requirements. Every use of patients' data should be consensual, safe and transparent. People should be told what's going to be done with their data and given, the choices that they have and the means to exercise that. That might be a form, that might be online, but that's basically being able to have their permission or their consent asked. Then when data is gathered, it should be safe. But Matt Hancock himself this morning mentioned trusted research environments. Rather than sending out copies of data, keep it in one safe place and have lots of rules and protections around that, and tell every patient, because of these pseudonyms, tell every patient how their data is used.
Phil Booth, we're out of time. Tina, I'm so sorry we lost you. If you can hear us, I'm sorry we couldn't get you back, but thank you very much. But of course, we can hear you now, but just as we're out of time. I'm so sorry about that, but thanks for joining us. We're going to take you, just before we go, through the front pages very quickly. The Daily Telegraph has Michael Gove, no new Scottish referendum before the next election, and Britain's in EU being denied rights, warns Patel. The Guardian has ministers will push to sell Channel 4 in a TV shake-up, and checking in, that's the game this evening. I hope you haven't left it to watch later. The last 16 England win, but game over for Scotland. Sorry if I've just been your spoiler. And the Daily Mirror there, coronavirus crisis, daily test holds hope. No quarantine plan for fully vaccinated travellers and kids to be made exempt. That is all from us tonight, but we will be back at 10:30 tomorrow. Hope to see you then. Bye-bye.